Given the association between obesity and fibromyalgia, it's not surprising that adhering to a healthy diet can have a significant benefit. According to recent evidence, vegetarian diets are particularly beneficial for decreasing the pain that's associated with fibromyalgia, not only because they induce weight loss, but also because they're rich in antioxidants. This is recommended based on the evidence that oxidative stress, or free radical damage, plays an important role in the development of fibromyalgia. However, adhering to a specific dietary pattern might not be necessary if enough antioxidant-rich foods are consumed regularly. Some data suggest that acupuncture produces short-term pain relief, but these benefits don't appear to last very long. Other promising alternative interventions include movement-based therapies like yoga, tai chi, mindfulness meditation, and hydrotherapy. Although no individual dietary supplements have been proven to be effective for relieving all of the symptoms of fibromyalgia, some of the following supplements have been linked to symptom improvement, or they've been recommended by experts to overcome the deficits that are common among the fibromyalgia patients. Researchers have revealed low circulating levels of magnesium have been implicated in the development of fibromyalgia. Magnesium supplementation has been shown to reduce the symptoms of fibromyalgia, thus making it a frequent recommended supplement. In one clinical trial involving 80 women, 60 with fibromyalgia and 20 healthy controls, a diagnosis of fibromyalgia was associated with significantly lower red blood cells and serum magnesium levels. And furthermore, lower magnesium levels were associated with more severe fibromyalgia symptoms. The trial went on to assess the effects of 8 weeks of supplementation with magnesium citrate at 300 mg per day, alone or in combination with amitriptyline. While both the magnesium and the amitriptyline alone effectively improved many of the assessed parameters, the combination of the two was more effective than either alone, and it significantly improved pain, tender joints, depression, and anxiety scores, as well as sleep disorders and irritability. The patients with fibromyalgia should consider having a red blood cell magnesium test to ensure that they're not deficient in this nutrient. Melatonin is a hormone and it helps to regulate the sleep-wake cycle. Clinical studies have found some fibromyalgia patients often have low circulating levels of melatonin, and this can lead to disruptions in the sleep cycle. In addition, fibromyalgia patients appear to secrete less melatonin during the night than the healthy controls. Among these patients, melatonin supplementation has been shown to decrease the symptoms of fibromyalgia. S-adenosyl L-methionine, or SAMe, is a natural compound and it's made from methionine, an amino acid, and adenosine triphosphate, or ATP. Supplementation with SAMe has been linked to improvements in morning stiffness, fatigue, quality of sleep, and the clinical disease activity among the fibromyalgia patients. In addition, other studies have shown that SAMe provides relief from depression, which sometimes occurs in people with fibromyalgia. D-ribose is a sugar and it helps to increase cellular energy synthesis in the muscle cells. One trial involving 41 fibromyalgia patients found 5 grams of D-ribose 3 times a day, significantly improved the energy, sleep, mental clarity, pain intensity, and the general well-being. Another small trial found 3 grams of D-ribose twice a day, improved exercise capacity, vitality, and mental outlook in adults 50 and older. Similarly, a case report of a 37-year-old with fibromyalgia indicated 5 grams of D-ribose twice a day improved her symptoms. CHLORELLA is a genus of single-cell green algae, and it grows in fresh water and contains high concentrations of important vitamins, minerals, dietary fiber, nucleic acids, amino acids, enzymes, and other substances. CHLORELLA has been shown to relieve the symptoms of fibromyalgia when used as a supplement. In a small pilot trial, 18 patients with fibromyalgia experienced an average 22% decrease in the pain intensity after taking CHLORELLA for 2 months. 5-hydroxytryptophan, or 5-HTP, is an endogenous precursor to serotonin. It can be derived from the seeds of the African plant Griffonia. It's a more direct precursor to serotonin than L-tryptophan. In fibromyalgia, it's supported by data indicating that impaired tryptophan metabolism is found in the patients. Clinical trials have shown supplementing with 5-HTP is associated with considerable improvements in anxiety, pain intensity, quality of sleep, fatigue, and the number of tender points. CoQ10 is an essential component of healthy mitochondrial function, as well as a powerful antioxidant. It's demonstrated anti-inflammatory and analgesic properties in animals. Researchers believe low levels of CoQ10 play a role in the development of fibromyalgia because CoQ10 has been found to be lacking within the blood cells of many fibromyalgia patients, and subsequent CoQ10 supplementation at 300 mg a day for 9 months has been linked to a significant improvement in the symptoms in a small preliminary trial. Other data from case reports also suggests a role for CoQ10 in relieving the fibromyalgia symptoms. Acetyl L-Carnitine is an acetylated version of the amino acid L-Carnitine, which is a mitochondrial membrane compound, and it aids in the generation of metabolic energy, and it guards against oxidative damage. It's been suggested that fibromyalgia syndrome might be associated with metabolic alterations, including a deficit of carnitine. In one double-blind, randomized, placebo-controlled trial involving 102 fibromyalgia patients, 1,000 mg oral and 500 mg intramuscular injection of acetyl L-carnitine daily significantly improved the pain and cognitive symptoms more than a placebo. Omega-3 fatty acids can only be synthesized to a limited extent in the body, but they're vital for normal metabolism. Omega-3s modulate several cellular properties, and they've been shown to reduce inflammation. Among fibromyalgia patients, omega-3 fatty acid supplementation has been linked to significant improvements in pain severity, tender point counts, fatigue, and depression. Another case report indicates supplementation with fish oil, providing 2,400 to 7,200 mg of EPA and DHA per day, eased neuropathic pain in a small number of subjects with fibromyalgia and or related neuropathic pain. Patients with fibromyalgia syndrome have impaired mobility, and therefore they get less exposure to sunlight, and this contributes to the vitamin D deficiency that's frequently observed in this population. In one trial involving 100 women with fibromyalgia, 61% were found to be vitamin D deficient. Upon supplementation of the vitamin D, 69% of the women reported significant improvement in their symptoms when the vitamin D levels reached greater than 30 nanograms per milliliter. The improvements became more significant when their vitamin D levels exceeded 50 nanograms per milliliter. Fibromyalgia patients should have their vitamin D levels checked regularly. Superoxide dismutase is an endogenous antioxidant, and it's found in decreased amounts among fibromyalgia patients. Superoxide dismutase occurs in plants, and it can thus be extracted from them. In one double-blind trial, supplementation with 1,000 mg per day of a plant superoxide dismutase extract significantly boosted the SOD activity and decreased the CRP level in athletes when compared to placebo. Vitamins A, C, E, and the mineral zinc all provide antioxidant protection. In one study, fibromyalgia patients had lower blood levels of vitamin A and E, as well as increased lipid peroxidation when compared to healthy controls. Another study found fibromyalgia patients had lower zinc and magnesium levels than healthy controls. In a survey of over 300 fibromyalgia patients, 35% reported using vitamin C, and vitamin C combined with vitamin E has been shown to boost the antioxidant activity in conditions related to oxidative stress. B vitamins are important cofactors in a variety of metabolic events. They were reported in a survey to be used by a quarter of fibromyalgia patients. Homocysteine is a damaging metabolic byproduct whose levels are kept in check by adequate B vitamin intake. In one study, women with fibromyalgia were shown to have higher levels of homocysteine in their cerebrospinal fluid when compared to healthy controls. Other evidence indicates that a Myers cocktail, which consists of intravenous infusions of several vitamins, i.e. B complex vitamins, can be useful in fibromyalgia. Moreover, B vitamins are essential for maintaining the optimal mitochondrial function. Nicotinamide adenine dinucleotide, or NADH, is a coenzyme and it supports numerous metabolic reactions that are critical for the optimal cellular function. For example, NADH helps to recycle CoQ10, thereby aiding in cellular energy production. It also possesses considerable antioxidant potential. Supplementation with NADH has been shown to improve energy in people with chronic fatigue. Similarly, NADH relieved sleepiness and cognitive deficits in people who are suffering from jet lag. In other trials, NADH improved cognitive function among people with Alzheimer's disease, and it relieved Parkinson's disease symptoms. While NADH has yet to be studied in people with fibromyalgia, these findings are encouraging since fibromyalgia sufferers often experience fatigue and suboptimal cognition. For more on herbs, supplements, and natural treatment plans, check out my website.